is Charlene. This is going to be a new series that we're working on into bringing, how do we find resources for Black women and, really just women of color. And in this first intro into topic, I actually want to introduce my really good friend, best friend. We've been friends for I don't even know how long, since like beginning of college. But she is actually a licensed therapist. Her name is Tiffany Jackson, and she has a years of experience, but I'll let her tell you a little bit more about her.
Hi, everyone. My name is Tiffany Jackson. I am a licensed clinical social worker. I have been in this field for quite a while. I became a licensed social worker in 2013, and in 2019, I became a licensed clinical social worker, and I currently provide therapy to a vast population of people.
That's great. So, what kind of population do you typically see? Like, what are your clients typically look like? Do you just deal with children? Do you do adults? Like, who do you typically see?
Honestly, I work with both. I would say my clientele right now is about half and half. So half are children. And when I say children, I mean from the age of 6 to about 21. And then, then I work with adults as well. Um, so I see everyone. I see men, I see women, I see small children, everybody.
That's great. And what made you go into this practice?
Um, let's see. I enjoyed learning about people. People are very interesting to me. When I first went into school, I actually went in for science. Environmental science was my original major, and then I took this class with his name was Carlton James, and I just fell in love with psychology, and from there. I decided that I wanted to change my major, and then I opted to get my master's in social work.
That's great. I feel like it's definitely something that suits you very well. For people who don't know Tiffany, Tiffany has like an amazing judge of character. And she's frequently somebody that I go to myself just when I have questions and I just honestly need like a great perspective on things, even when I don't want to hear maybe everything, but it's always great to have somebody who's willing to give you the truth. And so you can really look at bigger pictures. So I really felt it was important to, introduce Tiffany to this because I think it's very important that I think as women of color, a lot of times we feel like we're carrying a lot of weight and we may not always have the resources or know who to talk to and who to share that with, especially because there can be a lot of stereotypes or biases to people getting, additional help and talking to somebody. So I really felt it was important to bring this here, especially like during the pregnant and postpartum phase. I myself was diagnosed with postpartum anxiety and depression, and it was even Tiffany herself who even noted herself that like I was not doing well. And it took a little bit of time for me to figure that out and to go and seek additional help. But I felt like I couldn't even turn to like, my mom or somebody else just because like she's never dealt with this and just thought it was baby blues. And I think it's important that we kind of build our village to have people that can support us, that can recognize when something's wrong, but also are able to kind of help you to figure out how to fix these things. So my hope is by creating this new channel is that I kind of provide resources and kind of decrease any prior thoughts or biases that people may have, especially surrounding like mental health and getting help for it. So I do have a few questions to ask Tiffany that she's going to go through with us. So we're going to get started.
I take on a client, or as I'm working with a client, we have a treatment plan. Generally speaking, that we will identify their top three goals. So within those goals, we will work on their specific needs. Every client is different in terms of what their specific needs are, but what I'll typically do is I'll process with them the events that are taking place, and then we'll determine from there what are the things we need to address first. We talk about stress relief. I think one of the biggest things is that sometimes people don't know how to identify what their triggers are, or sometimes people don't even realize that something is not the norm. Like a lot of times I'll hear people tell me, um, well, I have to deal with that, or that's just part of life, when the reality of it is that it's not. So our first step is one, identifying that there is a problem, and then from there, we'll decide what are the techniques we're going to use to address those
Like
stressors.
family or friends could look out for if they know a pregnant or postpartum mom and they think she's struggling, but they're not really sure what that actually looks like. What's something that they could possibly look out for and say, like, hey, maybe you do need additional help?
So that's kind of hard to say only because everyone is different. However, typically we know our friends and we can tell the difference in their behavior. We'll tell the difference in their thought process as they address certain things. So those are usually the initial signs that you'll see. You'll see like slight changes. You may see the person withdrawing a little bit more. And when it comes to postpartum depression, also the way that they reference or regard motherhood can sometimes be um, a, a major sign, or I don't want to say a red flag, but it's definitely a sign that there could be something going on because of um, the way they may be addressing their baby, or how they describe what they're experiencing at the time. So the thing about community is that it's very important in terms of um, children, just generally speaking,
Mhm.
right? So a lot of times with those who are experiencing postpartum depression, one of the things that I often see lacking is their sense of community and feeling as though they have the support.
Mhm.
And community looks different for some people. Again, everyone is individual, but community looks different. One of the common things that I see is that um, women feel like they have to do it all.
Mhm.
Even if they have a partner, even if they have parents and family who are around, they still feel as though they have to do it all. And so, one of the things that my clients and I talk about is how do we allow others to show up for us?
Mhm.
How do we also set boundaries with those who they consider to be their community? And unfortunately, there are some people who they genuinely don't have anyone. So what we'll do is we'll figure out how can they build a community for them. So there are resources in the state of New Jersey that could help them. So sometimes we'll refer to those resources. I've even had some women who, believe it or not, they've gone on Facebook groups and they've built a sense of community in that way. They'll go and they'll join like those mommy and me groups, or they'll have their children join different activities in order for them to meet other people. And that is another way that they're able to build community if they don't have one that's automatically there.
Because like people outside of New Jersey, like that is like a great way for people to kind of build like a community as well. So I'm really glad you mentioned like because I don't know if that's something a lot of people really think of, or sometimes some moms are told like don't join the mom groups early on because you'll get like a bunch of different information and may confuse you. But I think a lot of times
Mhm.
going to Facebook for answers may not always be like the best thing. You should probably seek out like professional opinions. However, like going for like a community definitely seems like a better idea.
Back to the first question that you asked me, these two questions kind of link because going back to that plan that I make with my clients, that might actually be a goal of theirs. So we make it a priority where we recognize they need community. So one of their goals may be how can they build this through the resources in their community, through friends, allowing people to be there. But we just make sure that it's really a priority for them. And when we meet the next time, we'll follow up in terms of how they were able to achieve that goal.
That's a really great plan.
Just from processing what their current experiences are.
Mhm.
So, typically, when people are speaking and when you ask them questions, and I don't, for anyone who's done therapy before, typically you'll answer the same question a couple of times. And sometimes people ask me, well, I filled that out on this survey. And then, I may ask them the question again. And the reason for that is because people will share different information based on when they're answering the question and how comfortable they are with the questions that you're asking them. So from the survey to our conversations, I'll be able to determine what could be helpful for them based on the information that they share with me. So,
Mhm.
for example, if I hear a mom who is constantly with her children, then part of her coping skills would be independent time. That, then we'll pick, what does that look like? Does she enjoy music? Will she go for a walk? Like, how can she do things independently and things that are enjoyable, things that are not stressful? Sometimes, and this might be debatable for some people, but with my clients, like sometimes I'll have people say, "Oh, I'm going to get my nails done and my hair done." And I'll let them know that we cannot use that as a coping skill because getting your hair done and getting your nails done, it looks nice in the end, but sometimes the process itself can feel taxing. It feels like work. So we pick specifically what is actually leisure activity for them and what actually makes them feel good. And then we'll kind of go from there. We'll see what works and what doesn't work.
I feel like that's such a great point because I feel like this is something that you said to me that my therapist also had like kind of reinforced is that doing tasks such as going to the grocery store and doing your everyday like hygiene maintenance is not a set of time like for your therapy. That is not time for just you. That is your basic maintenance that you do as a human. That you shouldn't look at as that as your time of just individual time for yourself. Like that is you doing a chore. And I think that's a lot of times that for us like as women or like people who don't always have that support system is that we use that as like a way to get our break, but you're right, we're still actively doing a task or chore that is a level of like maintenance. So I think that is
Right,
something that you really mentioned that it's like important that we don't tie our breaks to things that we would do any other day. So I think that's a
right.
good point too.
Some of the barriers that I see when working with people, as I mentioned before, some people don't realize that certain things are a problem.
Mhm.
So because they don't realize that it's a problem, they're not as willing to work on it. So that can be a barrier. Another common barrier is the lack of support that people feel from their outside world. So um, they may feel silly in terms of addressing certain needs. So, for example, let's use baby blues versus postpartum depression, right? I get the sentiment of baby blues, but in my opinion, people use that term to kind of downplay what's actually happening sometimes. So that can be a barrier. Another barrier can be a lack of resources. So there's something it's called Maslow's hierarchy, which basically is when you're unable to meet your basic needs, you're unable to then meet your psychological needs. So for some people that I'm meeting with, they may be having issues with housing, work, just things that we need in order to survive, making sure they have enough food. So because they can't address those things, it makes it difficult for them to work on the mental health piece, which is completely understandable because that is primary. So I would say that those are the major barriers that I tend to see. What was the second part of the question?
How do they overcome them, the barriers?
Um, so with my clients, we tend to talk about what those barriers are. Um, and then we try to take a solution focused approach in terms of how can we meet those needs. And when I say solution focused, and I say that because sometimes people just want to talk about things rather than figuring out how can they fix it.
Mhm.
So my particular clients, we tend to work on what is the solution. And some things won't have a solution, but the things that do not have a solution, we figure out how can we accept the things that are beyond our control.
Mhm.
And then from there, we're able to do the work and move past those barriers. So for example, if it is something that's like a resource like housing or something like that, we'll talk about what are the resources that are there to help them. So that's one way to get over that barrier. But other things, it is really them doing the work and really being okay with moving forward. and also seeing that this is a safe space. I think that's a big thing too. Like, when they feel comfortable with me, then I know that they'll be able to do what they need to do, you know? Those stigmas and those stereotypes that maybe their particular culture may have. And in my field, one of the major things that we're constantly being taught and having to understand is that we are working with diverse populations. So we're meeting people where they are at. We are not judging people for what their norm may be. So me coming in and not being judgmental, but being understanding of what's going on and then figuring out how this either can work for us or work against us. That is, how I typically um, address that in terms of working with diverse populations. So it's just meeting their needs according to um, how they view things. And again, sometimes those specific cultures may have its specific view about mental health, but again, as we're building a rapport and the client is seeing that we're here to help them, they're a lot of times able to overcome that belief that they have in the back of their minds. So I tend to use cognitive behavioral therapy, which is basically I always explain it as how you understand and view the world will influence how you behave within the world. So that we look at the thought process and how we can change that perspective to be beneficial and helpful to you. Does that make sense?
Yeah, yeah, that.
So I tend to use and we tend to say CBT. I tend to use CBT. And with that, we talk a lot about coping skills. With that, I talk a lot about boundary setting and boundary setting not only with other people, but boundary setting with yourself, because a lot of people do not set boundaries for themselves, especially in motherhood, because it starts to all blend. So we talk about that a lot. And we even use, I like to recommend grounding exercises. Um, Grounding exercises can be really helpful. That's typically you use your senses in order to help keep you right here rather than thinking too far ahead or going too far back into the past. The biggest thing is just making time for yourself.
Mhm.
You cannot be a mother all the time. Yes, you're a mother all the time, but you cannot be in mommy mode all the time because you lose pieces of yourself.
Mhm.
So, in terms of boundary setting, even if that means one night a week for an hour, it's just you. And I know for some people, they don't feel as though they have that opportunity, but when they really do the work, you will see that there are opportunities for it. It's just you have to find it. You have to make it work within your life, if that makes sense.
Yeah.
So I would say that's the biggest thing. Just setting the boundary that at least one night a week, you should have time only for yourself.
Good point, because I think that was something that I even had to struggle with myself. Because I felt
Mhm.
like before becoming a mom, I felt like very ambitious. I was going to school, I had plans in place, and I wanted to do everything. And then once I became a mom, I felt like I just became just a mom. Like I kind of forgot everything else I was doing. And um, you know, getting back into that, like there was also some guilt. Like if I go back to school, am I going to be present for my child? Like, am I going to be able to dedicate that time? But then I also kind of realized also it's like I still need to be me, Charlene. I still need to have my own goals and aspirations and not only be wrapped up in just being a mom, because then you do kind of lose a sense of yourself. And I felt like that was one of the things that really kind of helped me to kind of feel more like myself again. Albeit I think every person that has like a child, there's a period of time where you're going to feel like you're not yourself because you are dedicating so much of your time to growing this person and like making sure you're caring for them. And I know when I talked to my friends, who said like it took like a good like year, maybe a year and a half to start to feel like yourself again. But I feel like when I started to get back into like looking at certifications that I wanted and going to school and figuring out what I wanted for just me as like a person, I feel like that kind of helped
Mhm.
me to get back onto track of me being me again.
Yeah. And it's really important. And people, again, you get caught up in being a mom, so you don't realize these things sometimes until later.
Mhm.
And that's the other thing. Also, making sure you're setting boundaries with those around you and people respecting your wishes as a mom. And that's something that I often see with people where they feel like they have to conform to maybe it be society, maybe their family, maybe their partner in certain aspects, which, yes, we're going to take all these things into consideration, but being careful not to get caught up in what everyone else wants you to do as a mom.
Yeah, those are really good points. I think these were all things that like I had to like deal with myself personally. So I feel like I definitely understand and resonate with a lot of this. And I feel like this would resonate with like a lot of other parents as well.
It's okay to get help, right? And that sounds like a very basic piece of advice. But even when people come into therapy, they have their guards up a lot of times because even though they've made the first step of coming into therapy, they still have their reservation about it and getting help because so many people feel like I got it, I'll figure it out, I can do it on my own. But I think that would be my biggest thing for anybody, no matter, whether they're a parent or not. It's okay to get help when you need it. And it's okay to open up and really do the work.
Yeah, I think that's really important. I think I was lucky in the fact of having like somebody like you in my life to like take a hold and like recognize that I was not doing okay and bringing that to my attention. So I really hope that like people have somebody in their life that is able to recognize it. But if not, even if they can recognize it in themselves that something just feels a little bit off or that they need assistance, to not be scared to go and ask for help and to look into resources.
What I usually tell people, honestly, it's just easier to call your insurance provider and then see who they cover because sometimes that's where it gets tricky. So they'll send you a list of providers that are within whatever radius you're willing to go. A lot of places are doing virtual, so that is one way of getting therapy. That I would recommend is Headway. Headway isn't a therapy practice. It's more like a billing site. However, they have a whole bunch of therapists on there. You can find a therapist on there. So Headway is a platform that you can use to find therapy. Um, and those would be the best ways I would say for adults. If you are in the state of New Jersey, at least, and you have children and you need therapy for your children, there is a program called Perform Care that you can call. And Perform Care will provide therapy for children between the ages of 3 to 21. And some moms are under the age of 21, but you can get free therapy that way. So that would be another big resource. And it's short term, it's 2 to 3 months. But it is a step in the right direction and they'll assist you with getting additional resources.
That's great. That is really great because I actually didn't even know about that either. Um, and like, let's say if somebody was interested in maybe having you as a therapist, are you taking on new patients, clients, or do you have anything that if maybe they can't book with you, you would just suggest for them to go to those resources?
Yeah, so I am taking on new clients. I can actually be found on Headway. That's that's how a lot of my clients find me outside of referrals. But Headway is a way that I can be found as well. And again, my name is Tiffany Jackson. But if not with me, of course, the resources that I mentioned, those are great ways to find.
Thank you so much, Tiffany. I really appreciate you providing this interview and helping people to get these resources. And I also appreciate just you as a person as well. I think it's really important. And I was lucky in myself is that I think being a woman of color, like a lot of times we kind of encounter different things in life that is kind of hard to navigate, that we may not always have the lesson plan on how to navigate. But I was lucky enough to have a friend that is not only a woman of color, but also a therapist. So that even though I don't go for her, like, because I don't want a conflict of interest and we're friends, but able to help me through like some of those things. And I am able to talk to her. But I think it's really important that we, really start to share our community and we make, resources known so that people can also get that help when they are facing these things. So I want to thank you for your time. I appreciate it.
Thank you for having me.